Welcome to Ultrasound Review 5. This video has multiple choice questions for kidney, adrenal glands, scrotum, GI, thyroid and parathyroid. There are 140 questions in this video. You can go directly to each system by clicking the time chaptered in the description. What is the area of the kidney where the vessels and ureter enter and exit called? A. Renal cortex. B. Renal column. C. Renal hilum. D. Renal pelvis. The answer is C. Renal hilum. The main functions of the urinary system are: A. Regulation of water and electrolyte balance. B. Removal of waste and storage of nutrients. C. Regulation of water balance and blood glucose level. D. Removal of waste and regulation of water and electrolyte balance. The answer is D. Removal of waste and regulation of water and electrolyte balance. Blood vessels in the renal calyces are located in the A. Renal capsule. B. Renal sinus. C. Renal pelvis. D. Renal hilum. The answer is B. Renal sinus. Layer of connective tissue encapsulating the kidneys is called: A. Gerard's capsule. B. Glisson's capsule. C. Gerald fascia. D. Gerard's fascia. The answer is D. Gerard's fascia. Which of the following is the functional unit of the kidney? A. Nikon. B. Natron. C. Nephron. D. Neuron. The answer is C. Nephron. What are the arrows pointing to in the following image? A. Column of Burton. B. Junctional parenchymal defect. C. Dromedary hump. D. None of the above. The answer is B. Junctional parenchymal defect. Kidney is an intraperitoneal organ. True or false? False. Left kidney is slightly lower than the right kidney in most of the patients. True or false? False. Describe the echogenicity of the lesion seen within the kidney. A. Echogenic. B. Hypoechoic. C. Anechoic. D. Sonolucent. The answer is A. Echogenic. What is seen on the above image? A. Junctional parenchymal defect. B. Dromedary hump. C. None of the above. D. Hypertrophied column of Burton. The answer is D. Hypertrophied column of Burton. What is in the image? A. Junctional parenchymal defect. B. Dromedary hump. C. Hypertrophied column of Burton. D. None of the above. The answer is B. Dromedary hump. Which of the following is the most common cause of acute renal failure? A. Hypertension. B. Autosomal recessive polycystic kidney disease. C. Diabetes. D. Acute tubular necrosis. The answer is D. Acute tubular necrosis. Which of the following is the most common cause of chronic renal failure? A. Hypertension. B. Acute tubular necrosis. C. Autosomal recessive polycystic kidney disease. D. Diabetes mellitus. The answer is D. Diabetes mellitus. True or false? Enlargement of the unaffected contralateral kidney with unilateral renal agenesis, or compromised renal function is referred to as compensatory hypertrophy. True. The protective capsule of the kidney is referred to as Glisson's capsule. True or false? False. A bulge on the lateral border of the kidney is referred to as A. Renal hypoplasia. B. Duplicated kidney. C. Dromedary hump. D. Supernumerary kidney. The answer is C. Dromedary hump. The vessel located anterior to the abdominal aorta and posterior to the superior mesenteric artery is the A. Left renal artery. B. Left renal vein. C. Celiac artery. D. Right renal vein. The answer is B. Left renal vein. What is the most common location of an ectopic kidney? A. Epigastric area. B. Pelvis. C. Umbilicus. D. None of the above. The answer is B. Pelvis. Sonographically, compared to normal kidneys, those affected by chronic renal failure will appear A. Anechoic. B. Sonolucent. C. Echogenic. D. None of the above. The answer is C. Echogenic. An inflammation of the kidney or kidneys is called acute pyelonephritis. The most common renal mass is simple renal cyst. Which one is not the symptoms of acute pyelonephritis? 1. Flank pain. 2. Bacteriuria. 3. Pyuria. 4. Leukocytosis. 5. Dysuria. 6. Diarrhea. 7. Urinary frequency. The answer is 6. Diarrhea. The condition of having pus, also referred to as purulent material, within the collecting system of the kidney is called A. Nephritis. B. Pyelonephritis. C. Pyonephrosis. D. Uteritis. The answer is C. Pyonephrosis. A rare, and yet life-threatening, complication of pyelonephritis is called A. Uteritis. B. Pyelonephritis. C. Pyonephrosis. D. Emphysematous pyelonephritis. The answer is D. Emphysematous pyelonephritis. What are sonographic findings of emphysematous pyelonephritis? 1. Gas or air within the renal parenchyma. 2. Dirty shadowing, reverberation artifact, coming from the renal parenchyma. Adrenal glands are retroperitoneal. True or false? True. The left adrenal gland is A. Posterior to the LT kidney. B. Medial to the upper pole of the LT kidney. A. Inferior to the LT kidney. D. Lateral to the LT kidney. The answer is B. Medial to the upper pole of the LT kidney. True or false? Cortisol is secreted by the adrenal medulla. False. Match the following: A. Conn syndrome. B. Epinephrine. C. Cushing syndrome. Match the following: Conn syndrome is due to high levels of aldosterone production. Epinephrine is adrenal medullary hormone. Cushing syndrome is due to high levels of cortisol production. A localized collection of blood describes A. Hepatoma. B. Hemangioma. C. Hemartoma. D. Hematoma. The answer is D. Hematoma. All of the following are associated with Conn syndrome except A. Thinning arms and legs. B. Excessive thirst. C. Hypertension. D. None of the above. The answer is A. Thinning arms and legs. The adrenal cortex produces all of the following except A. Aldosterone. B. Adrenaline. C. Cortisol. D. Androgen. The answer is B. Adrenaline. Which of the following is produced by the adrenal medulla? A. Cortisol. B. Aldosterone. C. Androgen. D. Norepinephrine. The answer is D. Norepinephrine. Which of the following hormones are responsible for the flight or fight response? Select 1, A. Cortisol and aldosterone. B. Cortisol and androgens. C. Epinephrine and norepinephrine. D. Adrenocorticotropic hormone and androgen aldosterone. The answer is C. Epinephrine and norepinephrine. The most common sonographic appearance of a pheochromocytoma is A. Hypoechoic. B. Anechoic. C. None of the above. D. Hyperechoic. The answer is D. Hyperechoic. The diameter of a varicocele measures more than how many millimeters? A. 2. B. 3. C. 4. D. 5. The answer is A. 2. The testes are covered by a fibrous capsule formed by the A. Tunica albuginea. B. Cooper's fascia. C. Cremaster muscle. D. Dardos muscle. The answer is A. Tunica albuginea. The testes measure a 6 cm long, 3 cm in depth, 3 cm wide. B. 4 cm long, 3 cm in diameter, 2 cm wide. Circa 2 cm long, 5 cm in diameter, 5 cm wide. D. 4 cm long, 3 cm in diameter, 3 cm wide. The answer is D. 4 cm long, 3 cm in diameter, and 3 cm wide. Sonographic characteristic of the normal testis include an homogeneous pattern with dense internal echoes. B. Homogeneous pattern with low-level internal echoes. C. Homogeneous pattern with medium-level echoes. D. Inhomogeneous pattern with medium-level echoes. The answer is C. Homogeneous pattern with medium-level echoes. A linear stripe of variable thickness and echogenicity running through the testis in a craniocaudal direction represents the A. Cooper's fascia. B. Mediastinum testis. C. Epithelial layer. D. Dardos muscle. The answer is B. Mediastinum testis. The epididymis is located where to the testis? A. Anterior and inferior. B. Anterior and superior. C. Posterior and inferior. D. Posterior and superior. The answer is D. Posterior and superior. Which one of the following facts about an undescended testis is false? A. The testis originates in the retroperitoneum at the level of the fetal kidney. B. All undescended testes are found in the inguinal canal. C. An associated risk for testicular malignancy can develop. D. An increased incidence of infertility exists. The answer is B. All undescended testes are found in the inguinal canal. The most common cause of acute scrotal pain in the adolescent is A. A varicocele. B. Epididymis. C. Testicular torsion. D. An inguinal hernia. The answer is C. Testicular torsion. Common causes of hydrocele include all of the following except A. Trauma. B. Microlithiasis. C. Epidydymorchitis. D. Testicular torsion. The answer is B. Microlithiasis. Which one of the following statements about varicoceles is false? A. Varicoceles refer to dilated, serpiginous, and elongated veins of the pampiform plexus. B. Varicoceles are more common on the right side of the scrotum. C. Primary varicoceles result from incompetent valves in the spermatic vein. D. Secondary varicoceles develop from compression of the spermatic vein. The answer is B. Varicoceles are more common on the right side of the scrotum. A spermatocele is always located in which portion of the epididymis? A. Head. B. Neck. C. Body. D. Tail. The answer is A. Head. A common cause of acute scrotal pain in adults is A. An epidermal cyst. B. Epidydymorchitis. C. A spermatocele. D. Testicular torsion. The answer is B. Epididymoorchitis. Which one of the following almost always transpires secondary to epididymitis? A. Orchitis. B. Hydrocele. C. Spermatocele. D. Varicocele. The answer is A. Orchitis. Tubular ectasia of the reedy testis is associated with A. Hydrocele. B. Varicocele. C. Epididymal cyst. D. Inguinal hernia. The answer is C. Epididymal cyst. A seminoma of the testicle generally appears on ultrasound as what mass? A. Hypoechoic. B. Complex. C. Hyperechoic. D. Anechoic. The answer is A. Hypoechoic. Epididymoorchitis most commonly results from A. Trauma. B. Virus. C. Bladder infection. D. Sexually transmitted. The answer is C. Bladder infection. A clinical history of a vasectomy is associated with A. Testicular torsion. B. Sperm granulomas. C. Microlithiasis. D. Varicocele. The answer is B. Sperm granulomas. The primary source of blood flow to the testicles is via what arteries? A. Renal. B. Internal iliac. C. Testicular. D. Centripetal. The answer is C. Testicular artery. Intratesticular cysts have an association with A. Spermatocele. B. Germ cell tumors. C. Hydrocele. D. Microlithiasis. The answer is A. Spermatocele. Microlithiasis of the testis is associated with A. Hydrocele. B. Inguinal hernia. C. Spermatocele. D. Malignant neoplasm. The answer is D. Malignant neoplasm. Follow-up examination of patients with microlithiasis is recommended A. Semi-annually. B. Annually. C. Every 5 years. D. Follow-up is not recommended. The answer is B. Annually. Attached at the superior pole of the testis between the epididymis and the testis is which one of the following? A. Reedy testis. B. Mediastinum testis. C. Appendix testis. D. Spermatocele. The answer is C. Appendix testis. A hydrocele develops between the A. Visceral and parietal layers of the tunica albuginea. B. Tunica albuginea and tunica vaginalis. C. Parietal and visceral layers of the tunica vaginalis. D. Scrotum and tunica albuginea. The answer is C. Parietal and visceral layers of the tunica vaginalis. The reedy testis is located A. At the hilum of the testis. B. In the epididymis. C. At the superior pole of the testis. D. At the inferior pole of the testis. The answer is A. At the hilum of the testis. Compared with the testis, the epididymis typically appears A. Anechoic. B. Hyperechoic. C. Hypoechoic. D. Homogeneous. The answer is C. Hypoechoic. The appendix is located on the abdominal wall under the A. Iliac crest. B. Mabarney's point. C. McBurney's sign. D. McBurney's point.
The answer is D. McBurney's point.
Which one of the following is an embryologic mistake? A. Duplication cyst. B. Gastric bezoar. C. Polyp. D. Leiomyoma.
The answer is A. Duplication cyst.
Metastatic disease to the stomach may be secondary to all of the following except A. Breast, B. Lung, C. Prostate, D. Melanoma.
The answer is C. Prostate. The question was asking about except.
The maximum outer diameter of the normal appendix can measure up to how many millimeters? A. 2. B. 4. C. 5. D. 6.
The answer is D. 6 millimeters. Remember that when you measure the appendix, you measure from outer to outer wall.
A diverticulum is most common in the A. Stomach, B. Small intestines, C. Colon, D. Ileum.
The answer is C. Colon.
Which one of the following statements about Crohn's disease is false? A. Crohn's disease is regional enteritis. B. The reaction involves only the mesothelium of the bowel wall. C. Clinical symptoms include diarrhea, fever, and right upper quadrant pain. D. Crohn's disease affects the terminal ileum or the colon or both.
The answer is B. The reaction involves only the mesothelium of the bowel wall. Remember that in Crohn's disease, it can involve all layers of the bowel wall.
The most common tumor of the gastrointestinal tract in children under 10 years of age is A. Lymphoma, B. Pulp, C. Leiomyoma, D. Fecalith.
The answer is A. Lymphoma.
The colon is divided into segments called A. Villi, B. Valvulae connivens, C. Haustra, D. Ruggi.
The answer is C. Haustra.
The celiac axis, superior mesenteric artery, and what artery supply both the small and large intestines? A. Lumbar, B. Inferior mesenteric, C. Splenic, D. Renal.
The answer is B. Inferior mesenteric.
Which one of the following divisions of the duodenum courses to the level of the gallbladder neck? A. First part, B. Second part, C. Third part, D. Fourth part.
The answer is A. The first part, which is the superior portion of the duodenum.
Which one of the following structures is often visualized on a sagittal ultrasound as a bullseye or target pattern anterior to the aorta and posterior to the left lobe of the liver? A. Pancreatic duct, B. Common bile duct, C. Ligamentum teres, D. Gastroesophageal junction.
The answer is D. The GE junction.
The entrance of the esophagus into the stomach is through the what orifice? A. Esophageal, B. Diaphragmatic, C. Thoracic, D. Cardiac.
The answer is D. Cardiac.
The greater curvature of the stomach is supported by all of the following ligaments except the A. Greater omentum, B. Gastrohepatic ligament, C. Gastrophrenic ligament, D. Gastrosplenic ligament.
The answer is B. Gastrohepatic ligament. This one you can figure out even though if you don't know the anatomy, because the question is asked about accept. And gastrohepatic ligament is far away from the stomach curvature, so you can reason this one out.
The progression of acute appendicitis to frank perforation is more rapid in A. Preschool children, B. Elementary school children, C. Adults, D. Senior citizens.
A. Preschool children.
Symptoms of appendiceal mucosales may include all of the following except A. Asymptomatic, B. Urinary symptoms, C. Bloating, D. Sepsis.
Except C. Bloating.
Gastrointestinal leiomyosarcoma most commonly occur in the A. Duodenum, B. Jejunum, C. Ileum, D. Ascending colon.
C. Ileum.
The pseudokidney sign may be seen in A. Chronic appendicitis, B. Meckel diverticulum, C. Gastric bezoar, D. Gastric carcinoma.
The answer is D. Gastric sarcoma. Remember, pseudokidney is not a good sign, therefore gastric sarcoma is a deadly disease.
Which one of the following statement about gastric carcinoma is false? A. Gastric carcinoma is the fourth leading cause of death. B. Of the malignant tumors of the stomach, 90% are carcinomas. C. 1/2 of these malignant tumors occur in the pylorus. D. 1/4 of the malignant tumors occur in the body and fundus.
The answer is A. Gastric sarcoma is the fourth leading cause of death. It's not the fourth, it's the sixth leading cause of death.
The answer is B. Dilation of the bowel loops proximal to the site of the obstruction. Acute appendicitis may be seen on a transverse sonogram as a what mass? A. Hypoechoic, B. Hyperechoic, C. Target-shaped, D. Anechoic.
The answer is C. Target-shaped. Appendicitis, target-shaped. Appendicitis, target-shaped.
The what is found anterior to the pancreatic body and is sometimes confused with the pancreatic duct. A. Fundus, B. Body, C. Gastric antrum, D. Pyloric canal.
The answer is C. Gastric antrum.
Sonographic finding of Crohn's disease may include all of the following except A. Symmetrically swollen bowel pattern, B. Uniformly increased wall thickness, C. Matted loop pattern, D. Calcification.
The answer is D. Calcification.
The keyboard sign is seen in the A. Colon, B. Duodenum, C. Appendix, D. Stomach.
The answer is B. Duodenum. Keyboard sign is seen in the duodenum.
The mesentery projects from the parietal peritoneum attaching to the A. Large intestine, B. Duodenum, C. Stomach, D. Small intestine.
The answer is D. Small intestine.
The what has a target shape and is located in the midline anterior to the pancreas body. A. Fundus, B. Body, C. Gastric antrum, D. Pyloric canal.
The answer is C. The gastric antrum.
What hormone is released by the presence of fat in the intestine, regulates gallbladder contraction and gastric emptying? A. Serotonin, B. Pepsin, C. Calcitonin, D. Gastrin, E. Cholecystokinin.
The answer is E. Cholecystokinin, CCK.
What is the blind pouch of the colon located in the right lower quadrant posterior to the abdominal wall? A. Duodenum, B. Cecum, C. Sigmoid, D. jejunum.
The answer is B. Cecum.
Distension of the appendix or the colon with mucus is A. Appendicitis, B. Mucocele, D. Diverticulitis, E. Crohn's disease.
The answer is B. Mucocele.
Rhythmic serial contractions of the smooth muscle of the intestine that forces food through the digestive tract are called what?
Peristalsis.
What part of the colon forms the hepatic flexure? A. Ascending colon, B. Descending colon, C. Transverse colon, D. Sigmoid.
The answer is A. Ascending colon.
What part of the colon forms the splenic flexure? A. Ascending colon, B. Descending colon, C. transverse colon. D. Sigmoid.
The answer is C, transverse colon.
The lobes of the thyroid gland are connected by A. The isthmus. B. Parathyroid tissue. C. Isthmal tissue. D. Island tissue. The answer is A. The isthmus. Hyperfunction of all parathyroid glands with no apparent cause occurs with which one of the following? A. Primary hyperplasia of the parathyroid glands. B. Primary hyperparathyroidism. C. Secondary hyperplasia of the parathyroid glands. D. Secondary hyperplasia of the thyroid gland. The answer is A. Primary hyperplasia of the parathyroid glands. All of the following structures form neighboring structures for the thyroid gland except the A. Longus colli muscle. B. Sternocleidomastoid muscle. C. Parotid muscle. D. Strap muscles. The answer is C. Parotid muscle. A higher percentage of positive cells are observed in what of a thyroid mass? A. Small calcifications. B. Anechoic portion. C. Center. D. Complex portion. The answer is A. Small calcifications. What is a palpable anterior midline mass between the hyoid bone and the isthmus of the thyroid gland? A. Carotid aneurysm. B. Brachial cleft cyst. C. Parathyroid adenoma. D. Thyroglossal duct cyst. The answer is D. Thyroglossal duct cyst. Common disorders associated with hyperthyroidism include all of the following except A. Toxic adenoma. B. Toxic multinodular goiter. C. Graves' disease. D. Acute thyroiditis. The answer is D. Acute thyroiditis. A cystic formation lateral to the thyroid gland is typically which one of the following? A. Thyroglossal cyst. B. Brachial cleft cyst. C. Cystic hygroma. D. Sublingual cyst. The answer is B. Brachial cleft cyst. A solitary thyroid nodule in the presence of ipsilateral lymphadenopathy suggests which one of the following? A. Adenoma. B. Graves' disease. C. Malignancy. D. Hashimoto's thyroiditis. The answer is C. Malignancy. D. Hashimoto's thyroiditis. All of the following structures form neighboring structures for the thyroid gland except the A. Longus colli muscle. B. Parotid muscle. C. Strap muscles. D. Sternocleidomastoid muscle. The answer is B. Parotid muscle. An abnormal lymph node demonstrates which one of the following? A. Homogeneous texture. B. Central echogenic complex. C. Oval contour. D. Round contour. The answer is D. Round contour. Approximately 20% of solitary thyroid nodules are A. Cystic. B. Adenomas. C. Goiters. D. Malignant. The answer is A. Cystic. Common disorders associated with hyperthyroidism include all of the following except A. Toxic adenoma. B. Toxic multinodular goiter. C. Graves' disease. D. Acute thyroiditis. The answer is D. Acute thyroiditis. Increased vascularity with color Doppler, termed the thyroid inferno, is observed in A. Hashimoto's disease. B. Graves' disease. C. De Quervain thyroiditis. D. Papillary carcinoma. The answer is B. Graves' disease. Sonographically, the normal thyroid gland may be described as having all of the following characteristics except A. Diffusely homogeneous. B. Slightly more echogenic than surrounding muscle. C. Fine homogeneous echo texture. D. Having a thin, hyperechoic line representing the thyroid capsule? The answer is A. Diffusely homogeneous. The approximate dimensions of the thyroid gland are a 5 cm length, 2 cm width, 2 cm depth. B. 4 cm length, 5 cm width, 2 cm depth. Circa 3 cm length, 5 cm width, 2 cm depth. D. 6 cm length, 3 cm width, 3 cm depth. The answer is 5 cm length, 2 cm width, 2 cm depth. The most common cause of primary hyperparathyroidism is which one of the following? A. Thyroid adenoma. B. Parathyroid adenoma. C. Parathyroid cyst. D. Parathyroid hemorrhagic cyst. The answer is B. Parathyroid adenoma. The most common cause of thyroid disorders worldwide is which one of the following? A. Hypothyroidism. B. Iron deficiency. C. Iodine deficiency. D. Autoimmune process. The answer is C. Iodine deficiency. The most common cause of thyroid malignancy is what type of carcinoma? A. Papillary. B. Medullary. C. Anaplastic. D. Follicular. The answer is A. Papillary. The normal parathyroid glands measure less than how many millimeters? 3, 4, 5, or 6? The answer is B. 4 millimeters. The parathyroid glands are the what organs in the body? A. Calcium sensing. B. Potassium sensing. C. Vitamin K sensing. D. Vitamin C sensing. The answer is A. Calcium sensing. The thyroid gland is part of the what system? A. Skeletal.lb. Gastrointestinal. C. Endocrine. D. Reproductive. E. Vascular. The answer is C. Endocrine. Sonographically, the normal thyroid may be described as having all of the following characteristics except A. Inhomogeneous echogenic pattern. B. Sternocleidomastoid, longus colli, and strap. Muscles are hypoechoic compared with thyroid tissue. C. Homogeneous texture of medium echogenicity. D. Tubular, anechoic vessels. The answer is A. Inhomogeneous echogenic pattern. All of the following improve scanning visualization of the parathyroid/thyroid gland except A. Using longus colli muscle as a landmark. B. Having the patient hyperextend the neck. C. Flexion of head and shoulders. D. The use of a high-resolution transducer. The answer is C. Flexion of head and shoulders. Landmarks for the transverse image of the thyroid include all of the following except A. Trachea. B. Common carotid artery. C. Axillary vein. D. Jugular vein. The answer is C. Axillary vein. A longitudinal image of the thyroid and the lateral aspect should include the following structure: A. Parathyroid gland. B. Carotid artery. C. Larynx. D. Isthmus. The answer is B. Carotid artery. What are the neck muscles that are seen as a larger oval band? They lie anterior and lateral to the thyroid gland. A. Longus colli muscles. B. Esophageal muscles. C. Sternocleidomastoid muscles. D. Omohyoid muscles. The answer is C. Sternocleidomastoid muscles. A normal functioning thyroid with adequate amounts of thyroid hormone is called what? A. Thyroid agenesis. B. Hyperthyroid. C. Hypothyroid. D. Euthyroid. The answer is D. Euthyroid. If the thyroid is scanned in a transverse plane, the labeling annotations should include all of the following except A. Mid. B. Superior. C. Lateral. D. Inferior. The answer is C. Lateral. If a sonographer is scanning in a longitudinal plane and presently imaging the external jugular, in which direction should the transducer be moved to see the main thyroid gland? A. Medial. B. Lateral. C. Superior. D. Inferior. The answer is A. Medial. The mechanism for producing thyroid hormones is what metabolism? A. Sodium. B. Calcium. C. Zinc. D. Iodine. The answer is D. Iodine. Blood is supplied to the thyroid gland by how many vessels? A. 2 arteries and 2 veins. B. 3 arteries and 1 vein. Circa 4 arteries. D. 4 veins. The answer is C. 4 arteries. If a sonographer is scanning the inferior lobe of the thyroid in a transverse plane, in which direction does the transducer need to be moved to image the isthmus? A. Inferiorly. B. Superiorly. C. Axially. D. Laterally. The answer is B. Superiorly. The structure arises from the isthmus and tapers superiorly just anterior to the thyroid cartilage. A. Carotid artery. B. Pyramidal lobe. C. Superior lobe. D. Parathyroid gland. The answer is B. Pyramidal lobe. In a sagittal scan of the thyroid's inferior lobe, the most inferior portion is located on the what side of the screen? A. Left. B. Right. C. Top. D. Bottom. The answer is B. Right. What hormone is a thyroid hormone that is important for maintaining a dense strong bone matrix and regulating the blood calcium level? A. Serum calcium. B. PTH. C. TSH. D. Calcitonin. The answer is D. Calcitonin. A solitary thyroid nodule in the presence of ipsilateral lymphadenopathy suggests which one of the following? A. Follicular carcinoma. B. Adenoma. C. Graves' disease. D. Hashimoto's thyroiditis. The answer is A. Follicular carcinoma. The most common cause of primary hyperparathyroidism is which one of the following? A. Thyroid adenoma. B. Parathyroid adenoma. C. Parathyroid hemorrhagic cyst. D. Parathyroid cyst. The answer is B. Parathyroid adenoma. The normal parathyroid glands are located on the where and where surface of the thyroid gland? A. Anterior, medial. B. Anterior, lateral. C. Posterior, medial. D. Posterior, lateral. The answer is C. Posterior, medial. The parathyroid glands produce a hormone that affects the A. Kidneys, bones, and gastrointestinal tract. B. Gastrointestinal tract, breast, and scrotum. C. Liver, colon, and kidneys. D. Kidneys, heart, and colon. The answer is A. Kidneys, bones, and gastrointestinal tract. The pyramid lobe of the thyroid gland extends from the where? A. Inferior left lobe. B. Superior isthmus. C. Inferior right lobe. D. Superior right lobe. The answer is B. Superior isthmus. The thyroid gland consists of how many lobes? 2, 3, 4, or 6? The answer is A. 2 lobes. The thyroid is an endocrine gland that regulates metabolic function through the production of all of the following hormones except A. Thyroxine. B. Triiodothyronine. C. Thyrocalcitonin. D. Thyroliberin. The answer is D. Thyroliberin. Which one of the following structures lies medial to the left thyroid lobe? A. larynx. B. Jugular vein. C. Strap muscles. D. Longus colli muscle. The answer is A. Larynx. The thyroid gland develops at the floor of which structure? A. Primitive pharynx. B. Trachea precursor. C. Maxilla. D. Nasopharynx. The answer is A. Primitive pharynx. Which one of the following sonographic features of a thyroid adenoma is the most common? A. Complex echo pattern. B. Hyperechoic mass. C. Hypoechoic peripheral halo. D. Irregular margins. The answer is C. Hypoechoic peripheral halo. Usually, how many parathyroid glands exist? A. 2. B. 3. C. 4. D. 5. The answer is C. 4. When the serum calcium level what? The parathyroid glands are stimulated to release PTH. Increase, decrease, or the same? The answer is decrease. Which one of the following structures lies posterolateral to the thyroid gland? A. Longus colli muscle. B. Hyoid muscle. C. Larynx. D. Internal carotid. The answer is A. Longus colli muscle. Thank you for watching. I hope this video helps with your exams. Good luck! Don't forget to share, like, comment, and subscribe.